and through her patients. Because when you have a chronic illness, you're always being looked at and mistreated. People say it's in your head or it's not there because I'm 50 years old. I'm an athlete, and well, I was an athlete, and to look at me, you wouldn't think. So you get brushed under the rug and dismissed a lot. So for her to be just able to listen and be compassionate about it, when I ordered it, the first thing I noticed is both of my knees are bone on bone, and they are always swollen for the last several years. And I've got about, I don't know, 20 screws between my neck and my lower back. I've had 18 surgeries, breast cancer survivor, and I have a genetic disease called Ehlers-Danlos syndrome, which affects all my connective tissue. So I'm always slipping in and out of alignment. So my body's working harder than the average person, but I couldn't exercise because my knees were swollen every day. And every time I took a step, I would feel that popping of bone on bone. And within the first week, that was the first thing I noticed. The swelling was gone. And this was like, I was holding out for something so I wouldn't have to have knee surgery. And I actually am back to jogging, which is
Wow.
is unheard of, and my knees don't swell. So that's huge. I mean, I was walking around with a walker, and my diagnosis, there's no cure and there's no treatment. It's maintenance. It's keep you comfortable until you die, basically. It's horrible. But I knew that eventually through technology and science, somebody would figure it out. And that's what this is. So it's like, it's hope in a patch, because
I
I
love
can
that.
have my life back. I'm still, I don't even think it's been 3 months. So I know I still have a ways to go, and I'm just going to keep improving and improving. But to get on a treadmill and double my speed, double my incline and my duration, that was like a dream come true, because I think I was 30 when a doctor told me I'll be in a wheelchair by the time I'm 50 because of the pain. And I just turned 50 and I'm jogging around the neighborhood. So
How much difference did you make in that short period of time on the treadmill? That's outstanding. I made sure that we
yeah,
recognize that.
that was within the first week. And I'm not kidding. And I will push things to see, like, okay, let's see how far I can go. And I couldn't even get to the gym. I was going to the gym maybe twice a month because I'd have so much time to recover just from one workout. And the dog wasn't getting walked, like nothing was getting done. So as soon as I started on these patches, I started noticing the knees. Okay, let's try the gym. I was going to the gym 4 days a week and hitting that treadmill, going on a 4 incline at a speed of, I think the highest speed I went was like a 3.8, 4, and the duration was for 30 minutes. And then I would do it backwards for about 5 minutes. So I mean, that's
Amazing.
just, yeah. So
Amazing.
within the first week, yeah, and it's just gotten better.
Tell us about the drugs that you have had to be
Oh,
on for a long period of time.
over for more than 10 years, I have had to be on morphine in the morning and at night.
Mm.
Dilaudid, which, you get during surgery. You don't take it during the day when you're home, but the pain was so bad, I would have to take Dilaudid on top of the morphine. And then if I had any breakthrough pain, I'd have to take hydrocodone, which is Norco, another narcotic. And then I take a muscle relaxer because my muscles would always cramp, and it'd get to the point where I'd be screaming on the floor because I couldn't move. It was so painful. Um, I mean, I get stuck in the bathtub because my body would just cramp. So stuff to sleep because of insomnia, and then all the side effects of all that medication. So in the last year and a half, I've dwindled down, but especially since being on the patches. The other day, it was the day last Wednesday, as a matter of fact, I was telling Deborah, I'm like, I don't feel good. I feel really sick. Like my body aches. I just don't feel right. So she was helping me out. And then I realized at the end of the day, I forgot to take all my pain meds. I didn't need them because
Wow.
I didn't feel anything. It was like, oh, that's my body's withdrawing, but I'm not needing the pain meds. So that is huge.
That's outstanding. And
Yeah.
those drugs that you were on are dangerous
Oh,
because
yeah.
you have been on the calls before. You know, that is how our daughter slipped into a coma and has been left mentally disabled because of those drugs that you just mentioned.
Yeah.
So what we see that there's a question in the chat because we want to know what patches you started out with and any that you added.
So I find personally for me, the bundle, definitely the X39, I will not go without X39. And the X49, that bundle package seems to really work well because with Ehlers-Danlos syndrome, you're constantly doing micro tears in your body, and that will give you like a flu-like feeling. So once I started with the X39, I don't even feel that anymore. So X39, X49, I just started using the Carnazone because I'm genetically predisposed to Alzheimer's, and Eon. So
Okay,
those are my go-tos.
thank you. To say that you started on the X39 and then within a very short period of time, I believe you told me the other day, a week to 9 days, you were out of pain, pain that has been so severe that for sure you were going to be in that wheelchair, not being able to even get out of that.
My prognosis was more surgeries. That was it. It was, my doctor said, look, let's just keep you medicated until to prevent you from having surgeries. But that also meant I didn't do anything. And you can't take an athletic person who enjoys moving their body and do that to them. It's horrible. It's like being put in prison. So to be able to say, I don't need to have any surgeries because the last 3 almost killed me. It's a godsend. It's an answer to prayer, and it's life changing, beyond life changing.
Well,